But the average large system provider, the individual market makes up a very small portion of their payer mix. And the study that was done with Milliman showed about 3 to 4% would be this product for those large payers or for large providers and hospital systems.
Got it.
Just,
Thank you. I was
sorry.
wondering
Yeah.
what that is. No, that makes total sense.
Yeah.
And you already answered the next question. Is waiver specific to the individual market? The answer is yes. Going to the next slide, governor's proposal for new federal savings. You're talking about cost shifting on the left-hand side at the bottom of the reinsurance area. What exactly what cost shifting are you talking about, from who and to who?
So both provide, so the carrier to the provider, right? So if we reduce the amount of money that they have to reduce in their premium by subsidizing it, that reduce that cost shifting onto the providers.
Got it. Makes total sense. And this is not specific to the exchange, but overall Medicaid, as you're well aware, reimbursement, at least the numbers I'm seeing, is about 40 to 45 cents on the dollar. So that's a significantly lower amount than what it actually costs the providers.
Well, we were on this one, we're talking Medicare rates, so not Medicaid. Just want to be clear. And yeah,
good to know. That's good to know. Yeah.
Also, I will just note, because I run Medicaid, so I feel like I have to give it a shout out for a hot minute, but Medicaid now pays the hospitals the average commercial rate on inpatient and outpatient through supplemental payments, because they the provider tax program that just started this year, and it pays up to the Medicare upper payment limit for fee-for-service program. So we've maxed out under Medicaid, at least on inpatient, outpatient hospital services. In physician services, we pay close to 95 to 98% of Medicare. So,
can you repeat that one more time?
98%. There's a Kaiser study. I'll send it to you guys. It's like 95 to 98% of physician services. We pay that 95% to 98% of Medicare rates. So we
Medicare
are
rates.
We're not the lowest in the country. Yeah.
Yeah, that's interesting. Okay. Yeah. And
sorry, I just always feel like Medicaid gets a bad rap. I'm not going to say it shouldn't always, but it's not always like, not all of our rates are bad. There are some though. But go ahead. Sorry, Sam.
Yeah, that'll be an interesting conversation, but we won't go there now. Okay. You're talking about quality metrics. Have you already determined that, or is that TBD?
So we have some stuff we're doing in the Medicaid side we probably will align with. That's something the carriers have given us feedback on. The big pieces, obviously, in Nevada, the big areas we lack is the maternal health population. Like maternal health is a huge issue for our program in Medicaid, as well as, I think statewide. Behavioral health, some of the HEDIS metrics that we use already in Medicaid will be aligning with that as well.
Okay, that makes sense. And the last question on that slide is the arrows that are going from reinsurance to quality incentive payment and workforce investment. Should those arrows be coming from the new federal waiver funds? I'm trying to understand.
So the money, I was trying to do a waterfall, because the money acts as a waterfall. So the money comes down, hits reinsurance. What's left bounces into quality.
Got it. Okay, that makes sense.
I'm not the best at visuals always, but that's what we
No. Yeah, now that you're explaining it, it makes total sense. And you're talking about provider impact mitigation, future mechanisms. What criteria should be met for the sharing to take place?
You mean the last one?
The provider impact mitigation, the first bullet, sub-bullet.
We haven't defined those fully yet. We're waiting till we get the bids back. We've asked carriers for feedback on all of those.
Okay, and my second bullet, my question is, why would a provider need a waiver?
Well, it's in state law that a provider, so right now, state law requires if a provider, because one of the things that happened in Washington was that the hospitals and other providers did not want to take or even participate in the networks for these products. Obviously, every state that has a public option is very different, so I wouldn't compare it to that Washington. But because of that, my understanding is there is a provision in the state law that says if you participate in Medicaid or have a Medicaid contract with the state to serve Medicaid enrollees and get payments, or you participate in the public employee benefit plan and you're a network provider, you have to treat these folks the same. And so it's a waiver from that if they're financially harmed.
No, that makes total sense. And the last bullet there, carriers must share the losses in meeting the premium reduction target. Are we talking about MLR or is it something different you're referencing?
So when you think of the premium, right, there's
Mhm.
the non-benefit and the benefit pieces. So non-benefit is typically your salary, profits, and then your
Correct.
benefit is the provider rates. They
Mhm.
can't just put the whole enchilada on the provider rates. They have to share it with the non-benefit, which would be their salaries and their overhead and those types of things. You have to
So that's a
report.
medical loss ratio of 85% for
Yes.
large ones and 80 for the
Yes.
small ones. Okay, that's what I thought you were talking about. So that's good to know. And the next slide, which is my last question. So you're going from 60,000 to a million cap, and about a million, is there some kind of a different insurance that the providers go through, or how does that work? Do you have any insight into that?
No, this would be the only reinsurance that would be offered. So if it hits that point, we would pay the pieces of the claim. So it helps offset those high costs for carriers.
So say, for example, you have someone where 2 million was spent. At 60,000, this kicks in up to a million. From the 1 million to 2 million, do they have a secondary insurance outside of what we are providing? How does that
I
work?
don't know if they do. I mean, I would probably call on my friends at Department of Insurance, but my understanding is there's probably not another program out there
I
like
would assume the carriers have their own reinsurance.
Stop. Yeah, but
Yeah,
this would be for the whole market that the state's paying for.
Yeah.
okay.
This is similar to a couple other states. I mean, this was modeled and looking at other state programs that have reinsurance programs.
Okay. Thank you so much for your time,
Yeah,
and thank you for patiently answering my questions.
no problem. Happy to.
Thank you, Sam. Great questions. Jonathan, did you have some
Yeah,
questions?
can I ask a couple of questions as well? One, and this kind of came up as you were talking and going through this, Stacy. Um, just the zero cost bronze plans. Folks that at a certain income qualification, I don't know what that level is. But it just kind of begged the question, if they go, it's my understanding if they go with a bronze plan as opposed to a silver plan, they forfeit cost share reductions. Is there an education gap there? Is there a way that we can identify those folks and give
Yeah.
them some education that for just a little bit out of pocket, the benefit of doing so is drastic. So that was one observation that stood out. I don't know what the opportunity is there, but I know that can make a big difference in their lives.
Yeah. On that point, I mean, maybe I shouldn't say this, but I will say it because I always say what I think. But I used to call it the bronze trap plan, right? Because it is a kind of a trap. It's really affordable, but you don't know you're going to get hit with that high deductible. And if you were, but it kind of, I mean, Russell probably knows better than I do about this market in, Nevada shopping on that exchange. But I think a lot of people look at that, monthly sticker shock and even with the subsidy, paying a premium still, reduces their income for the month. But I don't know. I know, Russell, you guys probably do a lot of education in that space. And so I don't know if you guys or the marketing team has any thoughts on that piece, but I think that is an area that needs a lot of help for consumers.
It's definitely something we emphasize, in particular in terms of our training materials for our Navigator and Agent Broker communities, really emphasizing the end of year out-of-pocket costs as opposed to the cost of the monthly deductibles. And you're exactly right. Given the lowest gross premiums associated with these bronze plans, they're the first ones that are going to qualify a household for a $0 net premium each month, not realizing that it's really not free insurance at the end of the day. It's a safety net, perhaps, and certainly light years better than no insurance. But you mentioned the word trapped, which I think can be an apt descriptor when you're hit with those especially high deductibles and max out of pockets.
It's I don't know. I think there's probably a lot of strong opinions with the folks on this call as with respect to that. But if we're in this for the consumer and those protections, we've got to figure a better way with those situations. And I get it. Sometimes even if it's $25, it's just not possible. But if they end up spending that in terms of
Right.
out-of-pocket costs. To me, that's more heartbreaking than, right, than the trap itself. And then the other question, these are plans that are going to be offered both on and off exchange. Is that correct?
In the individual
In the
market.
individual market?
So that
Um,
means like someone could go to the carrier and directly purchase it.
Sure,
Mhm.
sure. And so I guess what would make, with respect to the exchange, right? I get kind of outside of the exchange, someone just buying it privately, maybe they don't qualify for subsidies, things like that. To me, that makes a little bit more sense. But as it relates to the exchange, why would consumers choose a BBSP over another plan, given that the portion that they pay is tied to their income, not necessarily the premium
So the
of the
premium,
plan?
the premium reduction target, the way it will work, if it does work, I mean, that's always the experiment, right? So if plans do hit that target and it ends up being the second lowest cost silver, they will be the more affordable subsidized product. Just naturally, some of the most affordable products on the exchange, because we're not seeing other plans lower their premiums, right? Much ever. You don't see a 3% reduction in a year. So it really will set that target and set the subsidy.
Okay. And then the other question is in terms of the funding that's going to the reinsurance and all of those things. How did you arrive to some of those calculations and those estimates? And if enrollment were to fall short of target, what does that do to the whole program? What
So
does that
the target
look like?
doesn't need to be the enrollment. The key is whether or not we lower the second lowest cost silver and how much the feds would have otherwise paid. So as long as we reduce that trend in our premium spend, the state gets the savings to the Fed. So that's the target. I didn't set that number. We worked with actuaries who did actuarial science. There's a whole, I can send you guys the whole actuarial report if you'd like to see it. It's several hundreds of pages, but they looked at the trends in the market. And if you set it to 3, what does that mean in terms of who might enroll? There were a lot of assumptions that went into this and back and forth with the actuaries at CMS as well.
So it's safe to say that the goal is really for these plans to meet that second lowest cost silver plan, because that's where subsidies are going to be based
Maximize.
on. That's where the federal funding is coming in, regardless of what consumers choose beyond that.
Yes.
Okay.
That drives the funding, right? Yeah. The
Okay.
fed funds, yeah.
Perfect. Thank you.
You're welcome. Sorry, I know that everyone's probably tired and it's almost 4 o'clock, Russell. Thank you
Right.
guys.
Thank you so
Thanks.
much, Stacy. That was very informative. I'm not seeing any other hands. Am I missing anything? All right, let's move on. Thank you again, Stacy. Appreciate your time on that. The next agenda item, number 7, is discussion, consideration, and possible adoption of Silver State Health Insurance Exchange bylaw amendment as proposed by the subcommittee. And the subcommittee met today to discuss and develop a recommended evaluation process, which we're going to discuss under agenda item 8 today. However, as part of that process, it does require a change to the exchange bylaws to accommodate the evaluation of the executive director. Thus, the subcommittee is now recommending to the board that the amended language to bylaws state the following, which we did vote on in our subcommittee meeting this afternoon. So in reference to Article 4, currently it states, pursuant to NRS 695I-380, the board shall appoint an executive director who is responsible for the administrative matters of the board. This afternoon, the subcommittee met to attach the following language to that in Article 4, So we would, that first sentence would still apply, and then we would add, the board shall establish a procedure for an annual evaluation of the executive director. So that is what we did vote on earlier today. And I believe at this point in time, we are making that recommendation to the full board to adopt that amended bylaw language that was approved by the subcommittee earlier today. So at this point, I would take a motion to approve that language as we are bringing forward to you.
Madam Chair, this is Quincy Branch. I motion that we adopt and accept the language as submitted by the subcommittee.
Thank you, Quincy. Do I
Madam
have?
Chair?
Johnson, second.
Motion.
Yes, Levon?
I second the motion.
Oh, thank you. I didn't quite hear that. Okay, thank you very much. Is there any further discussion on that? Okay, seeing none. All in favor, please say aye.
Aye.
Anyone opposed? Anyone abstaining? Okay, motion carries. Thank you very much. And then agenda item 8, discussion, consideration, and possible implementation of recommended executive director evaluation process as proposed by the subcommittee. So we did also approve in the subcommittee the process that we would like to bring to the board for their approval for the evaluation of the executive director. Jonathan, do you want to go through that, or would you like me to? I don't mind doing it, but since you being the chair of that committee, I thought you might want to. So now I can't see your face anymore.
Yeah, sorry, I had to disconnect from the computer. I'm on my phone now.
Oh, okay.
But yeah, happy to talk through that just real quick. Give me just a
And I have my
second.
notes in front of me if you need.
Yeah,
me
if you can take that and
Sure,
walk
sure.
through the notes from our meeting, that'd be great. Thank you.
Okay, yeah. So what we had agreed to is that the Silver State Health Insurance Exchange Subcommittee will work in conjunction with the State Department of Human Resources Management to formulate a confidential 360 assessment. The questionnaire will be distributed to appropriate stakeholders who interact or have interacted with the executive director. The Silver State Health Insurance Exchange and the committee will develop the list of stakeholders that will receive the survey. The responses of the survey will go to and be compiled into a report by the State Office of Human Resource Management. And the report will be delivered to the subcommittee, who will evaluate it and bring it and present it to the board of directors for review and follow-up. So that's what we agreed in our subcommittee today and voted on and approved. So we are bringing that forward to you, the full board, for your questions, consideration, and potential vote. Are there any questions I can answer?
Madam Chair, Sam Kumar, I think we discussed this at length, either in the previous meeting and the one before that, so I'm totally comfortable with the approach.
Is that a motion, Sam?
So moved.
All
Levon,
right.
second the motion.
Thank you, Levon. Is there any additional conversation about that? Okay, seeing none, all in favor, please say aye.
Aye.
Aye. Any opposed? And is there anyone abstaining? Okay, motion carries. Thank you very much. Mr. Detmer, are you still on? Did I miss anything there? I just want to confirm that you feel that was all. I've included all the language that was appropriate at that time.
It sounded complete, Chair.
Thank you very much. Okay. Next on the agenda, we're almost done, people. Item 9, review and discussion of continuance of existing agreement with VSP individual vision plans. And this is for possible action.
But I did not mean to interrupt you, Madam Chair. I just wanted to provide a brief introduction to this agenda.
Thank you, Russell.
All right. So this item is intended to provide the Board of Directors with an opportunity to review the exchange's existing contractual agreement with VSP individual vision plans and consider the future status of that agreement. To provide a summary of the background of this agreement, in 2020, the exchange entered into a contractual agreement with VSP individual vision plans to host a link on the NevadaHealthLink.com website in exchange for an annual hosting fee. This link would direct consumers to VSP's website for the purchase of enrolling in off-exchange vision coverage, and the relevant page on our website I provided a link to in the agenda item here. This agreement, as was mentioned during the public comment, followed a pattern which had previously been established by other state-based marketplaces, including California and Idaho, wherein the state marketplace would partner with one or more vision carriers by driving traffic to their respective websites. The exchange's contract with VSP was amended in September of 2021 and again in March of 2023. These amendments merely increased the annual fee that VSP would pay the exchange in return for hosting the link. The obligations of both parties appear not to have been modified by the amendments. And although the contract was set up to automatically renew each year, at least in the most recent amendment, it does include a severability clause indicating that either party may terminate this agreement without cause upon 90 days prior written notice. So at present, it is within the board's purview to either continue the existing relationship with VSP, in which case no action would be required, or to terminate the relationship with 90 days prior written notice. I did want to mention also that representatives from VSP have prepared a slide presentation. And, even though we did hear from them during the public comment at the beginning of the meeting, I did review the slides they had prepared. And in my opinion, there was additional information in the slides, particularly some metrics about enrollment numbers that was not included in the public comment. And that is why I'm recommending that the board consider reviewing this presentation right now. I'm very mindful that we're just now reaching the 2.5-hour mark. So if the board is okay with this presentation, I will ask our partners at VSP to please be mindful of their time and to move as expediently as possible through the slides, which I'll share in a moment upon your approval, Madam Chair.
Thank you very much. Is everyone okay with that? I think it would be good to hear this out if we can. And it is for possible action, so we do need to keep our quorum. So please hang in there with us if you can. Okay.
Wonderful. And I should have mentioned this very brief bit of context up front. When this discussion was requested for the meeting agenda, we had discussed this with you, Madam Chair, as well as with Mr. Detmer, and we decided to split the discussion into two separate agenda items. This one is specifically to do with the existing agreement with VSP. The next agenda item will be a more general discussion about whether or not the board wishes to implement a formal policy, which would apply to any vision carrier seeking a partnership with the exchange.
Okay.
All right, and I will now invite our representatives from VSP to come off mute, and I'm happy to walk us through the slide deck. And again, I would just ask that you please be mindful of our time.
Of course, thank you. Really appreciate the time today. And really, this was just to supplement what was discussed. Obviously, I just reread a letter that you guys had access to and thought this additional information may be helpful and also maybe addresses a few of the questions that you might have that were not covered in that. So I've already covered the partnership solution, which was that redirect link. This is kind of a summary of that. It also shows that we have grown to over 400 active subscribers with an active policy. And also this last open enrollment, which led to January 1 enrollments, was the largest enrollment in a month we've had since the inception. And we tend to see that as it becomes more familiar with consumers, the numbers continue to grow. So Russell, if you wouldn't mind going to the next slide. This is just a 2-year snapshot. I couldn't squeeze in a longer one, but this started at 0 growth at time of launch and has grown to over 400. And we see a very consistent pattern of sort of a slow airplane taking off that continues to grow year over year. And this includes additions as well as terminations. So we see a very consistent pattern. This is also consistent with our experience with other exchanges that year over year, they tend to grow, and it's been a very successful program. Russell, if you would mind going to the next one. We do provide access to a reporting portal, which gives you some key metrics, including things like policy start dates, memberships, whether they're buying it for themselves or dependents, whether they've selected a month or annually, as far as payment models, which products they've suggested or selected. And then we do provide, sort of information on active versus canceled and what some of that churn looks like. So that reporting is available to you through a reporting portal, and you have administrative rights to provide that to whomever would like to see that. And that's an ongoing piece that's real-time data. And then a very blurry slide, which I did not put together on compliance, and that's, I'm a salesperson, not a compliance person. So this is not my purview, but we do have, obviously, we cover 80 million members. We're in every imaginable aspect of healthcare. So compliance and oversight at every level is just part of what we do, because we work with state agencies and so forth. So this is some of the detail on that. I obviously won't take the time to read through those bullets, but I just want to assure you that compliance is there and significant oversight is being done by our organization as well as our partners. And I think one question about the customer support, or what's the member experience and experience with us on, are we managing them? Are they happy? These are just a few of the bullet points on our touches throughout the year. We consider what we do a member nurturing, where we want them to see the value. We want them to use the benefit. As I mentioned, the well eye exam is critical for not only their eye health, but their personal health. So we do a lot of touches throughout the year to make sure that they're using that, provide information about the value of the savings that they get by buying a fully insured vision product and so forth. So there's a lot of touches. We manage that ourselves, and it's critical to the outcomes that we get, as well as the member satisfaction survey results that we generally get. And this is the sort of 12-month protocol where we onboard them, we nurture them, we remind them that their renewal is coming, and then we manage that renewal through this system. So they're only tied in for a 12-month program, and at the end of that 12 months, they can move on if they so chose. But we do a lot to inform them. There's no surprises. It's very important that we communicate well with them, and that is all built into the program. And as we had mentioned, if the preference is to move to a different model that's outside of what we're doing with the other exchanges, we can do that. There's some pieces that go with that, but it does require some additional work and some additional resource to do that. But we wanted to make that available should you choose to move forward as the only way to keep this together. We would certainly welcome revisiting that, but so far the SmartLink model has worked exceptionally well. And just wanted to let you know there's some flexibility for us should you choose to go that route. And finally, I'll let you guys get out at 4:05 here. Member satisfaction is a hallmark of what we do. We're not for profit, focused 100% on their experience and the quality of our services. And our member satisfaction's outstanding year over year consistently by line of business. And I just wanted to share that with you. Just about what it means to the actual consumer buying our products. So hopefully that alleviates some of the concern about not kind of keeping eyes on it, that it's performing well, members are happy, and that's been sort of the VSP experience consistently year over year. And that's it. Thank you very much for the time.
Mike. Yes, thanks. I don't know that I have any questions about the product. I think it's a quality product. I personally have worked with VSP my entire career. You know, as you know, I'm an insurance broker, so we sell vision plans constantly. I think where questions come into play are the fact that I don't believe there is any other vision carrier on the exchange. So where do we get that competitive, you know, how do people shop when they only have one option?
Right.
And I don't know, Mike, that's your issue as much as our issue.
Right.
What have we done as an exchange to promote competitiveness, you know, a competitive dynamic so that people are assured, you know, a variety of different rates and benefits and network access, because there are different networks. So that's what I think my personal concern is, that why are we not having other carriers competitively priced against your product so that they're, you know, keeping you guys in check, giving people options, there are lower cost options on the marketplace, but most people like VSP because of the network size. And so I don't know that's your problem to solve, Mike. I think that's our problem to solve.
Understood. I did want to share that on the exchanges, we do have exchanges where there are multiple carriers,
Yeah.
and we are on some state-based exchanges where we are the solo choice.
And we don't have an exclusive agreement between us, do we?
Correct. No,
Okay.
we do not.
Any other thoughts, questions? Sam?
Yeah, thank you, Madam Chair. To kind of add to your question, we don't want to be accused of preferential treatment. So Russell, that's something we should keep an eye on. If others have reached out to you, we have reached out to others, VSP competitors, that'll be really good. Going back to Mike, a couple of questions. You're talking about potentially VSP folks detecting hypertension, high cholesterol, and all of that. How often do you see that happening?
I don't know statistically how that comes up, but I know historically that optometrists through the well eye exam often catch some of those early onset conditions through a well eye exam. So I don't have those numbers. I apologize. That's not something I have access to because we're in so many aspects of healthcare. But almost all of our plans do have that annual well eye exam. And that's such a great opportunity to catch early onset condition. And we hear the story all the time about how their optometrist was literally the first person that got them in to see their PCP, and there's all kinds of stories about people catching all kinds of conditions. So and I bring that up strictly as the value add on top of the eye exam that's specific to the eye care. It's just sort of an altruistic additional benefit of offering vision and the value of offering vision to consumers.
Yeah, if you can track that down and send it over to Russell, that'll be great. I'm just curious. So great. Thank you.
Mike,
Yeah, happy to answer questions. Yeah.
Do you operate off of an MLR or a loss ratio for a group like this? Do you look at a group like this in the form of what it's generating versus what is being paid out?
Right. In general, the underwriting is done on an annual basis. The rates are revisited more in aggregate. We don't do customer specific MLR unless we get into things like our group business. The rates rarely change. They're actually state-based. So we have underwriting assumptions for different states because the provider payment varies by market. So it's really a state-based. We rarely have rate changes. And as you know, in ancillary services like vision and dental or other chiropractic and things like that, the cost of the benefit as compared to the administration of it, the MLR is pretty different because you get into a health plan product that's $400 or $500 a month versus $12 a month. Right. The MLR looks vastly different because there's just not much margin. So that has not changed much, to be frank.
Okay, I'm just trying to understand how you judge these relationships in terms of profitability.
Yeah,
and if we have
really
access
done in
to know
aggregate.
that.
Yeah, it's really done in aggregate. It's hard to do it. We don't want to re-rate based on group. We have really done it for the individual product in general because we're in so many different aspects of individual vision, and we sort of look at individual in total.
Sure, I understand.
Yep.
Any other questions?
Just really real quick. Sorry, Valerie, real quick. I know we're tired. Just want to say thank you. I think something worse we always see in Medicaid, obviously adult dental is not covered, but children is and pregnant women is covered. I think if we can move to covering that adult dental and Medicaid, it could help the whole market. I will say that, there are some contracting strategies that we might want to consider with our DBA contract, just like we require MCOs to offer products in the exchange. We could do a similar thing for our dental benefits administrator, Russell. So you could get other products, and back to Valerie's point around competition and options and choice. So I just throw that out there as something for folks to consider. But Mike, I really, obviously the mouth is part of the body. And I think it's just really thankful that you guys want to offer some coverage, but to Valerie's point, making sure we have a healthy market, I think is something we can consider. And Russell, we can maybe talk offline about options on that.
Yep.
Yeah, thank you for including me. I really appreciate it. You've been a valued partner, and we really appreciate it.
Thank you very much. And we don't want you to feel that you're not valued. You are. We just, I think we all want to make sure it's fair and competitive because, of course, that's what generates the best consumer experience. So.
Sure, understood.
Great. So do we need to vote on this? I'm sorry. Formal policy, let's see, review and discussion of continuance of existing agreement. So I guess, do we need to vote on this? Do we want to vote on continuing this agreement?
Mike Devon for the record. I was thinking about it just now. If you were not to vote on it and it would just be a discussion item, the status quo would be maintained. But if there's some action that you wanted to take, then you could vote on it.
Okay. So I guess I would open the floor to anyone who might want to make a motion.
Madam Chair, Sam Kumar, just a quick comment. Since we are planning on continuing anyway, so no action is needed.
I would agree.
Sam.
Levon, I'm sorry, I didn't quite hear you.
Oh, I agree that no action.
Okay. Yep. Okay, so we'll just let that one go. We don't need to take any action on that. And then the next item, consideration and possible creation of a formal policy related to vision carrier partnership. I think we could maybe take some action there, in terms of, I mean, my personal recommendation would be that we need to maybe include other vision carriers in an RFP type of a process or procurement process, just to open up the doors for competition and choice. I don't know how anyone else feels.
Madam Chair, Sam Kumar, I think that can be done offline. Don't know if it's an RFP, basically, and a little bit of recon to see if anyone else is interested. And if they are, I would imagine there should be some kind of a vetting process by the state supply chain before they can be included. So if Russell, if you're okay with that, can we assign that to you? You have your hands full with everything else, but thought I'll float that.
Thank you, Mr. Kumar. Can you clarify a little bit what the ask is? This is, by the way, precisely the type of dialogue that we were hoping to encourage with these two agenda items. I was just hoping to gain some additional clarity regarding the specific ask.
Yeah, like Valerie said, we'd like to have a competitive marketplace for vision plan as well, and also fairness in terms of offering others the opportunity to participate, not just VSP. If we can do some background research to see if anyone is interested, and send them through the vetting process and include some links there for others as well, if they are interested.
Okay. Well, for reference, we did put together a very brief attachment for this agenda item. The language that I had prepared, which is very brief, stated that ACA regulations do not have provisions for Nevada HealthLink to sell vision plans directly through the marketplace, but numerous state-based exchanges have entered into partnerships with vision carriers by way of the host referral link that we discussed earlier. So part of what we were proposing is that the board might consider the implementation of a policy which defines a process, potentially including selective evaluation criteria or formal guidelines for application, including a potential time frame for application, perhaps on an annual cycle, by which vision carriers might express interest in a partnership with the exchange. That would be a little bit more passive of an approach versus an active recruitment like an RFP. But again, we'd be more than happy to do some research in the meantime, perhaps even prepare a draft policy or our suggested course of action based on experience. For context, Mr. Kumar, because the discussion that sort of precipitated today's agenda items occurred back in June at our board meeting before your appointment to the board, and I had delivered in my executive director's report a recounting of an incident which occurred last fall where we were actually approached by another vision carrier besides VSP, and over the course of reviewing a number of criteria, we made the judgment call at that time that we weren't comfortable issuing a tacit endorsement of that carrier's services, specifically citing concerns about their customer service track record. So they're out there. There's definitely interest in partnering with the exchange. And the reason why I mentioned that in June was specifically to bring the board into the fold of that process, and sort of solicit opinions and suggestions for how we might better foster a competitive, relationship or, competition within the marketplace. Just wanted to make sure that we were getting out ahead of the board in terms of steering what that selection process or those criteria might look like.
That context is extremely helpful. Thank you, Russell. And if you don't mind coming up with a draft proposal, that would be great. Nothing that has to happen right away. Whenever you have some time, you have your hands full right now.
We'll shoot for getting that on the agenda for the December board meeting, barring any unforeseen, circumstances in the meantime. I think that should be doable. If we do run into trouble, though, certainly we'll reach out and let you know, and we'll seek advice by email if that sounds okay.
Sounds good. Thank you.
Excellent. Thanks, Russell. It'll be nice to see what's out there. Okay. Discussion and possible action of creating various advisory committees for proper oversight and support of the exchange.
Madam Chair, Sam Kumar again.
Yes.
That's an item that I had asked to include. Given that we are nearing the 3-hour mark, I don't want to be public enemy number one. So we can probably punt that to the next meeting. And what I would also do is I can put together a document and share it with you or with Tiffany. That way we can make it part of the pre-read for the next meeting so that we're all better prepared.
That sounds excellent, Mr. Kumar. Thank you. Okay. Topics, dates, times, and agenda items for future meetings. Sounds like we have a couple already that we've discussed. Anything else anyone would like to see on the next agenda? Okay, well, seeing none, we'll move on to public comment. Tiffany.
Madam Chair, thank you so much. Tiffany Davis for the record and for public comment. I'd like to say that anyone who has joined us on Zoom, if you would like to make a public comment, that you may raise your electronic hand feature or indicate in the chat box. If you would like to make a public comment, and our staff will let you know when you may unmute yourself. For those who have called into the meeting, we'll also let you know when you may unmute yourself to provide your public comment. At this time, I'll go ahead and go directly to our Carson City conference room. Cassie, do we have anyone in the physical location of Carson City office who would like to make a public comment?
This is Cassie Fuentes. There is no public comment here in the Carson City location. Thank you.
Thank you. And then let's see, online. Again, if any of our attendees would like to provide public comment, you may now raise your electronic hand feature on Zoom, and Cassie will call your name, and then you may unmute yourself for public comment. Cassie, do we see anyone with their hands raised for public comment?
This is Cassie Fuentes, and there are no hands and no comments.
Excellent. Thank you so much. And then on our phone lines, just one last time, if anyone calling in would like to go ahead and unmute yourself at this point and provide public comment, you may do so. Not hearing anything, Madam Chair. I believe we have no public comments. If I may add just one thing, right at this moment, our next regularly scheduled board meeting is for December 17th.
All right. Thank you so much, Tiffany. Appreciate your help, and I appreciate everyone that was here today. Thank you very much. Do we have a motion to adjourn the meeting?
So moved. Sam Kumar here.
Do we have a second?
Second the motion, Levon Lewis.
Thank you. Thank you, Levon. All in favor?
Aye.
Aye.
Thank you, everyone. I hope you have a really great evening and appreciate your time and participation today. Take care.